this is Tess with ROE Dental Lab. I'm out here with Dr. Porcello at Valley View Dental. Dr. Porcello, why don't you tell us a little bit about your practice?
We have a multi-doctor practice in a rural area. We have 4 dentists here that all have their own unique niches and specialties that they like to get into, and we treat a variety of patients from little kids all the way up to 102 years old, I think. So we do a majority of the dentistry in-house.
Very nice. And how did you get started with our impact or digital dentures? What expectations did you and your team have kind of leading into your first few cases?
We actually bought our first extraoral scanner quite a few years ago, maybe 5 years ago, and I had the idea that if we could take the impression in the patient's denture and scan that, then the lab would be able to use that to create a more accurate denture. And we had been doing this process for 2 or 3 years before we found Roe. So we had the process down, but we didn't have the lab partner down. And we went through, we had a few different labs that we had tried, and they couldn't do what we needed to. And when we partnered with Roe, they were able to fill in the missing piece to be able to create the impact dentures from the digital scans that we were able to.
Very well articulated. And explain what changes you or your practice kind of had with the workflow when you started working with Roe and your in-office technology.
It was really just getting to work with the technicians at Roe, because we had the practice or the procedure down for a few years before. It was just figuring out what fit best with Roe and what fit best with the way we had been doing it before. But basically, when we take a wash impression of the patient's existing denture and then a bite with that, depending on what we want, depending on how far off or close the denture is, if we want to do a try-in visit or if we want to go right to completion. It was just getting that working relationship together with Roe to see what works best in each case. So it didn't change our workflow very much at all.
Perfect. And what so far has been your favorite thing about working with us on these impact dentures?
I like the fact that we have our own denture tech, or our own representative, our own tech that works with us case by case. It's not one case goes to someone and somewhere else. If we have a problem, if we have an issue, if we have questions, we have one point of contact at the lab for that, and that's very handy.
Nice. And lastly, how do you think this kind of change between Roe and your practice and working together is going to benefit you and your patients?
It definitely benefits both us and our patients in the fact that we can get higher quality, better fitting dentures to them in a faster time. So that's a win-win for everyone.
Great. Well, we're happy to hear it and look forward to working with you and your team more, Dr. Porcello.
Thank you very much, Tess. Take care.